Alright guys, let's talk and drive. So, National Health Insurance. I'm sure by now a lot of you guys know what it is. It's basically government's version of what is implemented in the UK, which is the National Health and NHS, probably the National Health System, I don't know, which is basically a government provided or government subsidized medical scheme for the general public. Great idea, great initiative, but comes with a lot of complexities that need thorough integration of multiple governmental systems as well as private participation. Now, to have a successful general-based medical system, you need to have the whole country functioning, first and foremost. And function is not a matter of I go to hospital, some people get serviced, others don't get serviced, roll of the dice type of medical service. It's not that. You truly need everyone to be integrated and included, and sustainability is a very key factor. Now, a lot of government things tend to fail because their idea of sustainability is so long as taxpayers are paying, the finance department will just keep on giving budget. They will do what needs to be done, and if they need more money, they just keep on printing it from the finance side and just redistributing it, of which that in terms of economic terms is an absolute disaster, because you're causing inflation, printing more money, therefore making the money in our pockets and in the current system become worthless, and you're creating higher inflation, which the Reserve Bank is going to react by increasing interest rates. They increase interest rates, that makes loans more expensive, makes loans unattainable. In other words, people can't now develop their lives, they can't grow, and therefore you're stagnating the growth, the general growth of the country. And life just becomes expensive, everything is unaffordable. Then we're just literally going to enter a depression, can't afford services, private care becomes stagnant because nobody can pay for private care, so there's more reliance on this government free medical solution or cheaper medical solution. And I guess you guys get the point. It can become an unmitigated disaster very slowly and quickly, all in the same time. And that's my current problem right now. We're not even discussing the economical benefits of an NHI, which is really sad at this point. I mean, I first started developing ideas around the NHI around about 2015 or 2015. It was ready with the guys that one was working with, and at that point our system was relatively simple, but had addressed a lot of key components that right now, I mean, I literally don't know how to explain the current system. I don't know, but it clearly is problematic. It's so problematic, and it's basically rushed. And with all the public hearings happening and so forth, look, I get it, people have been submitting their responses, reactions and so forth, but at the end of the day, if all of these ad hoc solutions and everything that is sent forth to help and get this thing actually working do not get integrated or do not get accepted, it's all futile. And I truly believe it's a futile exercise, because right now the government is just using NHI as a political tool. Because truly, if this system was proper, going to work and actually benefit the people, it should have been done by now. We had a trial run around about 2012, 2013, somewhere there. I don't know if they've used the results of that trial run to improve the system. Even if they did use it, I don't think they used it in a useful manner, because that trial run in the first place was not even proper. And now, I mean, that trial run happened over 12 years ago, or just over 12 years ago. And you want to tell me now, when we're about to have the biggest, sort of most influential election since 1994, now you want to all of a sudden do this great universal based medical service? I find that very suspicious. I mean, it's a problem, in fact. But now let me go back to what I'm trying to say. So these guys are not being genuine. This system, the reason why it's not working, I mean, right now, the main problem that's in your face is you have students, medical students, that worked very hard over an enormous amount of years, plus enormous amounts of funding, money, school fees, education fees being paid for, hard studying and determination to pass, and only for the system to fail them. Like, it really baffles me that all things being said and done, you have a current system that has basically failed, because the system that really works is the private healthcare system. And the private healthcare system works because it's for profit. And when it comes to money, people want to earn their money. And what makes it even more of an oiled machine is because of medical aid. And going back to the example that I made of the economics, why that is so important is because medical aids are scarce, right? In other words, people that have medical aid, it's not the majority. It's a definite minority, and it's a super minority of people that have medical aid. In other words, those that work for government, they make up the majority of those that would generally not afford medical care to have medical care. And then it's certain jobs that have good packages for their employees that offer medical care, if you're truly enough lucky to work for such a company. And that's a whole lot of private companies, and most of them, I'm sorry to say, employ mostly white people. And white people or non-black people would have generally good medical care at their disposal based on their private working situation. And other entrepreneurs that are mostly African, black, and so forth, they wouldn't even offer medical care because it's expensive. They can't afford it, as take into consideration their business situation. People are saving costs, and I'm not trying to racialize this thing. It's just a fact. I mean, you look at the labor statistics, more non-black employees have medical aid in the private sector than black. It's just a fact. But I'm not trying to racialize this to distract the point. The point that I'm trying to prove is NHI should have been the equalizer that it is. And that being said, you look at how the private sector is properly set up and established. Yes, not everybody can afford. This is not to say that the private sector has everything sorted, but to say the least, the private sector engine of private medical care works, and you can actually see what's happening, right? And it's been working for years on years, and it's been improving, although there's still improvement. I mean, medical aid is expensive, guys. Let's not kid around that. And it's even more expensive if you have a child or you have a family dependent. A family of three, meaning a wife, husband, and a child, easily medical fees can run up to 10 to 15,000 plus per month for that family situation, right? depending on how comprehensive and how useful the medical aid is to you in terms of whatever medical attention that you might need. It's truly a very difficult situation, right? So that being said, all those companies that are offering medical aid need to have some very good business going on. They are paying their taxes, so government is still extracting some money from them. They're paying their employees are paying pay as you earn, and they have their medical aid. And then when you have medical aid as a group cover, that's very good inflows that goes to the medical aid service providers, your Discoveries, your Sundowns, your Liberties, and all these medical aid companies, Fed Health and so forth. Now, the money must come from somewhere, and it's a lot of it. And most of the time, you want to make sure healthy people are paying medical aid, because the unhealthy people then can be safeguarded in terms of the pool of the money servicing them, but it's a pool of money. And then these medical aid companies are using those pool of monies to invest in various businesses, and then therefore turning over that money or generate yields on that money that helps to actually keep the system secure. Now, this is something that has been happening over time, and it helps medical aid funds to be properly managed in order to handle the risk that they have. You have actuaries calculating risks that are posed by the participants or the beneficiaries to the fund, and they sort of balance everything all together. And that's just the complexity of managing a medical aid fund. Now, the government hasn't even spoken to that element, of which you would want the private sector to champion, because that's what they've been championing. But government should be making sure they have the means, or addressing the means of making the system cheaper. So there's various ways that you can make the system cheaper, and that's one way government can definitely help, which is to give them a pool of money. The greater the amount of money they have, or the fund, the administrative portion of the fund has, is going to allow for the business, it's going to allow for the fund to be able to turn over a greater yield, which can help to boost the fund. So that's already one solution that one can put into managing this NHI system. You want to have a huge pool of money being managed, and a decent return being generated or yielded of those huge funds, right? So that's one way of keeping it sustainable, because once again, investment is very key. Now, there's various ways that government has truly bottled investments. I mean, yeah, once again, it's going to point to making sure that the private sector gets heavily involved. But in a perfect situation, fund managers are very important in order to maintain the sustainability and the well maintenance of the risk to beneficiary factor of this system. So all of these things need to be addressed, and if they're not addressed, they really cause a problem that allows the possible implosion of the system. Now, that being said, that's the fund section, right? Government add more money, you help the situation, everything becomes fine. So another thing is sustainability in terms of the skills of, or the quality of skills, right? So in other words, you have a situation whereby you have junior doctors coming into the system, and it's not a surprise, guys. So long as it's universities and medical schools established, they have to be taken into by the system. There must be a plan integrated. Everybody, once again, as I started what I was explaining, it's all about the integration of systems. Now you have medical schools have to be integrated with either public and private, hospitals and medical service centers. And they must understand that every year there's a certain amount of graduates that are coming into the system. And how that has not been turned into a business model of some kind is staggering. On another level of consideration, entrepreneurship should be introduced and encouraged amongst graduates or aspiring graduates. I resonate with that because me, as an accountant, I did my vacation work and all that, and I decided, no, I'm gonna straight up go into private practice by starting my own firm and providing services by building my own firm and practicing in that way. And it has worked out for me. It was a big risk, but it has worked out. I have time, freedom, whatever the case may be. And the problem of doing these type of things is, how does it look like? Can it be integrated? There needs to be support systems. There needs to be a conducive environment. Once again, those are things that government should be doing and are just not doing. So that's a side note to get back to. So you have these graduates coming into the system. It goes without saying, they are coming. So why isn't there a mass adoption of these graduates, right? Also, it's potentially a nuanced issue, because it's not to say all of them are not being accepted. There's definitely people being accepted, and definitely on a private scale of things, it's about relationships, close proximity, and who you know, and those type of things, and also who's willing to help you. And people do actually get allocation into hospitals and so forth. So it's really a matter of access as well, which is something that, once again, this is the things that NHI is supposed to be taking advantage of, for it to be obviously useful, for us to see what it's going to do, where it's playing its part. And once again, you need that integration with private, with education, to successfully. I mean, you have people on NSFAS that are studying towards become medical doctors. Why aren't they integrated? Because monies need to be paid for the loans that they get. Yes, now it's a grant, but I mean, the system needs to be sustained. Ever since it became a grant, it's been the worst system ever. And, government is really just messing that up once again. As I'm saying, fund management, in a perfect sense, it can work so beautifully, but because people are greedy and don't care about the strategic objectives of such funds, we rise to the problems that we have now. So that being said, NHI needs to have an integration plan to absorb junior doctors, and this is equally beneficial because junior doctors should cost less, right? Yes, you can maybe change how the minimum salary or the base salary that doctors usually get. It could be lesser than the norm, which is fine, but so long as they get something, so long as they get employment. Because already right now, with some doctors, some situations trying to sort themselves out, people are getting some bit of compensation. It's little, but it's better than nothing. And it's unfortunate to subject doctors or just anyone that has worked hard to be in the system to such conditions. Now, yeah, there needs to be that type of integration, in a sense. So that being done, you put them in the system by virtue of creating a conducive environment, which it is available because the systems are there. It exists. It's not something that you're starting from scratch. So NHI should be funding that. It should be helping from an infrastructure development point of view and getting into partnerships whereby these graduates can be taken up. Now, they are cheap labor in a sense, so that's a deal in terms of a budgetary operational budget point of view. And as time goes, they get their experience, they start to specialize, and they actually benefit the medical industry as a whole. So that's a positive thing that needs to be taken care of and nurtured to make sure it produces the best results possible. Then the next thing is, what do you actually do with them? Now, as I'm explaining this, it's actually making me want to reveal exactly what we were looking to do, which our solution had a very huge focus on the new doctors, right? On the junior doctors, and making sure that the current doctors, who are the experienced and the ones that are outgoing, they transfer as much knowledge and expertise as possible to make sure that the junior doctors get fast tracked to being ready, to being, significant in the system. And that must be something that keeps on going, a well-oiled machine. And of course there are ideologies that need to be introduced, because you cannot want to be the mega super millionaire doctor specialist within these systems. There's a certain ceiling that you will get to, and once you achieve that ceiling, you're either going to be staying there because you want to stay there, or if you want to grow bigger in terms of money and whatever career aspirations that you might have as a doctor, you'd have to do something else. But the good thing is you will have a certain amount of capital, expertise, and so forth. And once again, a doctor doesn't really leave the industry. They leave where they are, and where they are going, it's for the betterment of the industry. And the more you have of that, is the more options from a junior level start to be established, because now the pathways are becoming longer and longer. Whereas the medical industry right now, the pathways have just become shorter. Hence, there is a bottleneck, which has always been there. I mean, when we were developing our idea, the problem was the bottleneck of junior doctors. This is a decade-old problem, and it's in the face of government right now. It's in the face of everyone. It's been harshly experienced, and now they want to, push through NHI as if it's the savior, but they are totally ignoring the matters that the elements that matter the most, which is the doctors, which is the system, and the integration of systems. And I'll explain that towards the end of the video, and exactly how we were looking to integrate systems. Now, you have this big problem that you're not solving, but you're ignoring by forcing a solution that does not solve the problem. So you see how this Frankenstein operation, electionary solution, that's what it is. It's a pure electionary solution that is helping no one, and it's creating more problems, because it's going to take money. It's going to take billions, as they have proposed to set this thing up. Those billions are not going to create anything. So in other words, we won't be able to touch them assets that we're talking about, and effectively what's going to happen is it's money going to be spent paying consultants, paying salaries of people, paying people that are getting commissions and kickbacks and so forth. And we're going to have no medical system. And the worst thing about when you talk about a medical solution, you're going to have people dying. That's really what it's coming down to. You're going to have people dying, and so many of them dying because you are creating a solution that people desperately need. Medical care is a serious thing. And with the way, health and wellness is at, medical care is of utmost importance now. So if you don't take, serious care into this solution, we are going to unmitigated disaster in terms of the loss of lives, in terms of, there's already depression amongst junior doctors in general. Doctors are overburdened, right? And some of them are taking their lives because of the mental impact that all these problems are causing. And once again, NHI should have been the saving grace of these things. Now, I say that, having addressed everything that I've said, I'll just highlight the solution that we were coming up with. So as I mentioned, there was a junior doctor program within our solution, which we seek to equip them with certain equipment, with basically a set of a package that helps them to be ready, and literally from the time they're done with medical school, they're getting integrated in the system in a way that you disperse them all over. So in other words, we'll have medical clinics, mobile clinics with a doctor, whether it's at a village, just anywhere and everywhere. Because remember, when you talk about national health insurance, it's not an insurance that it's not a medical service that you have simply because you live in an urban city and so forth. It must be spaced out everywhere, nationwide. It must be accessible to each and every place that is inhabited by people. And that was the idea. We were gonna have these mobile clinics, these RV looking like cars, having a fully fledged medical operation that can deal with your decent average medical procedures. Some of them might be able to handle certain, not surgery type of situations, but certain procedures. It just really depends. They'll be purposefully built, but nonetheless there was some level of medical attention. And these mobile solutions would have had a staff of up to 5 plus, at least one doctor, some nurses, an administrative person, and just everything being done effectively to handle the medical needs of people. Because when you're doing that, you're investing in infrastructure. Yes, doctors must go out there. Remember, now when you're a junior doctor, you have to serve, and this is part of the serving situation that junior doctors can be dedicated to. And they're going to be going out there and living in those areas, which is not a foreign idea. Doctors do that. It's part of their training, and you help, you serve, and government is properly investing in their career by helping them to be of service. Now you're doing that, it's feeding into the system, it's creating medical care, you're saving citizens money from traveling, wasting time, literally just perishing under harsh conditions simply just to get medical attention that they're not guaranteed in the first place. Because sometimes people go to the public hospitals, they're sitting on the floor, there's no beds, it's overcrowded, it's just a mess. So just that simple thought process of distributing medical junior staffers, junior doctor graduates across the country to the most remote places, to each and every place where there's a mobile medical center service that they are managing, that they are part of. There could be 2 of them, whatever the case may be. You operationalize those mobile centers, and healthcare is given. That's one of the elements. Then another element is to have integration of systems. Now we have Home Affairs, we have the Department of Labor, you have e-NATIS. All these government databases need to be integrated. Why are they being integrated? We need to know South Africans. NHI is primarily for South African citizens. From a Home Affairs point of view, if Home Affairs is running efficiently, their processes are up to speed, you are able to access the e-NHI system, and you use that e-NHI system to properly identify who's South African, properly identify who is of, who's an adult, who's a minor, who is deceased, because you don't want ghost beneficiaries. That's a problem. So you want to make sure you want to manage the people, the benefactors of the system. You want to know who's married, who's not married. All of these things is the information that you can pull from the e-NHI system, which is the Home Affairs system. You integrate it into this general NHI system that helps to manage the people on the system. Now, with labor, we can determine who is working. With SARS, we can determine who's working. And do they have their own medical aid, which is another thing. If you have your own medical aid, then you're ineligible to be on NHI because you can afford. Because remember, NHI will not compete against comprehensive offerings or private offerings. It will give the most basic and most needed medical care available, and therefore a need for comprehensive will still be there. Now we have all these systems that must work together. They don't necessarily have to replace each other, but they will improve each other so long as there's an intention to do so. So you have all of that going on, and these systems are talking to one another. You know who's supposed to be there. Then when it comes to foreign nationals, those that are rightfully within the country, they are able to get access to the medical services, because there is an integration plan to help South Africans and non-South Africans. Because once again, NHI, it's all about the efficiency of the system. Now, with that efficiency of the system being proposed or being introduced, then you go further to make sure that the service is well run, it's well maintained, it does what it does. And this is where we're using technology. And this is no AI, this is just pure tech and ingenuity. And one of the things that we're looking to introduce is a completely electronic system, right? And this electronic system is, you don't necessarily, yes, you can have your medical aid cards and whatnot, but it was really talking to the responsiveness of services, right? Because now you have medical service providers in terms of paramedics and so forth. Some of them will help you whether you have medical aid or not, which is really unfortunate. So to get rid of that, we on your system, remember now we integrated with Home Affairs and all these systems. Now we also have additional information about you. We have your biometrics, your iris scans, we have your blood types. All these informations will be integrated as information available. So in other words, if you're in an accident, the paramedic can literally help you by virtue of identifying you, whether it's by ID, all of this. Remember we talked about e-natus, vehicle information, all this information that's available there to help you, to help the paramedic to administrate health services to you upon first responding to the scene. So they can successfully identify you via your eyes, via your fingerprint, via all these information inputs that they can extract on the scene. And they know exactly what they can do. They know your blood type. If you need to be supplemented with blood, they can see what they need to see. If there's some prior medical things that they need to know about you, your medical history will be there and accessible, because the system is electronic. It can be accessed. Everybody has access to the system so long as they put in your information. Everything that's there to help you to get effective medical care would be there. I mean, guys, come on, put a like, put a W on the comment section if you really understand what I just said right now. Imagine that's almost a perfect system. And of course nothing is perfect, but imagine that the amount of lives that one will be saving by simply having the right intention to really save lives, to help people. So that was our system, guys. It had those integrations, and further than that, it had a plan to grow bigger, whereby there is monies generated from these things, because now there's big data. Big data is it's a very, very big commodity, and when used properly, considering POPI and everything, there is additional revenue opportunities, and these revenue opportunities, being used responsibly, can be used to further advance and improve the infrastructure of the medical industry. So that is really the high level sort of explanation of the idea. There's a lot that goes into it, and just to give you guys some insight why we didn't really push this thing, we met with the health minister, had a very long meeting. I think it was about 2 hours plus long, and we discussed what we had to discuss. We proposed our proposal, and it was greatly received. And what it really came down to was political willness, right? But yes, the minister did give us very real problems why NHI won't work. And this is what I'm saying, it won't work. I heard it from the man himself. He said it why it won't work. And it won't work simply because of, the constitutional rights of doctors. They exercise their rights, historically, when medical services were sort of sanctioned by virtue of, controlling how doctors priced their medical services. That was a problem then, and it was, challenged by the private sector in terms of doctors then, and they won, and subsequently doctors are now allowed to charge whatever they deem fit because it's their right. It's what they are doing, that it's their right? So you don't want to take away people's rights, but you want to understand that people have the right to practice and make a living as they see fit. It's their right? Now, that poses a problem to the NHI, because if you're going to introduce an NHI, never mind medical aid in the private sector, because that situation has solved itself. Just transfer the cost to the patients. But now NHI is coming as a budgetary consideration that gives general access. It has to be cheap. It has to be low cost. So one of the ways to deal with the low cost problem is to have fixed pricing or regulated pricing. Now, in hindsight, once again, you're not looking to replace current medical offerings, but you're looking to provide a low cost budget version. In other words, if you want a big house and somebody's going to have an RDP, the RDP does not affect the big house. You're going to build the big house so long as you can. So you will pay for more if you want more. Now, when it comes to medical aid, the finance minister was saying, look, we're fighting legal battles and so forth, blah, 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 whereby doctors don't want to allow government to regulate their pricing. And that fundamentally breaks NHI. We had to accept that. We had to accept it. But now, in hindsight, that was a ridiculous reason to accept, because once again, you're just offering an additional service that just happens to be addressing the needs of a wider population. I feel that government was just being power hungry. You don't have to put the private sector by its knees by forcing them, by you telling them how much they must charge. It shouldn't be. So therefore, that argument is not a reason to have sort of denied us or not, to go ahead with the idea. But once again, it's a political willingness thing. So that being said, there is so much that is so wrong with the current NHI proposal or bill. It's a pure electionary tool. It's not going to do anything. It's not going to work. In fact, it won't even take off. I said it. It's not going to take off because it's not a real system that they're trying to introduce. It's just a way to move money, to move budget, and continue what they're doing in a more nicer way for them to get more money, looking like they're doing something. I mean, to set up a medical aid fund is relatively easy. I already started the video saying you just add more money and find a sustainable way to manage those funds. You have benefactors sign up, you give them benefits, and you administrate the fund, and you push out benefits as and when the benefits are accessed. The problem is that fund's going to run out of money because it's going to be not effectively managed. Government has a trust problem in terms of its operational ability, and NHI does not need that. It needs absolute trust in the private and public sector. It needs absolute integration and access and sharing of information at a highly secure rate, and competency. A lot of competencies are needed. So yeah, guys, I don't want to make this video too long. I think I've shared enough and I've said what I need to say. Let me know in the comment section what you guys think. I feel like this is a very important thing that needs to be addressed, because medical health is a serious need, especially for the elderly. And it's so unfortunate when greed and power comes into play and does not, not that does not, but it actually takes away from the goodness of what a true and properly established NHI system can actually, generate for the normal man in the street. So yeah, guys, tell me what you think in the comment section. That's my driving talk for today. Please remember to subscribe, like, and share this video. And yeah, let me know what you want me to talk about. If there's nothing else that's interesting on the news or in sort of trending current situations, whatever the case may be. But yeah, guys, see you on the next one. Bye.